we first proposed this, the original timeline was for 3 months. After 3 months, we'd be at the point where we are now after 2 years. So I really appreciate the flexibility of CanWaCH to allow us to go where the science is taking us, rather than having to stick to what was rather a poorly thought out original timeline. That the question has been harder to answer than we thought it would be originally. And now with this time that we've had, I think we're at a reasonably good spot where we can share with you today. So that we started with, there's thinking that, there's mountains and mountains of data in the world, including an MNCH data that NGOs are collecting, and governments and other bodies collecting all this data. And do we really need to keep on collecting it, or could there be increased sharing and using one another's data, so that especially NGOs don't need to continue doing baseline surveys to figure out the situation that they are working in? So that's the sort of our starting point. Do NGOs need baseline surveys? So we have a question, just so we know who our audience is here today. A survey is going to pop up in a second. There we go. Have you been involved in household surveys? If you could answer that, and then we'll get the results soon. I'm going to keep talking while you all answer. So have you been involved in household surveys? So why would an NGO need to do a baseline survey? For project planning and project monitoring purposes. But why not do them? They are expensive. Say, I don't know what an average is, but certainly for a Canadian NGO on a moderately large MNCH project might spend $20,000 or $50,000 would not be unheard of for a baseline survey, taking hundreds of days of staff time. And then the burden on the respondents. The respondents are usually women, usually mothers with young children who have, okay, thanks for the poll results, 80%. So most of you know what it's like to be doing a survey. And so this burden that we put on the respondents, asking them to give an hour or 2 hours of their time, and they're usually young moms who are already super busy. And then publicly available data already exists, like DHS and MIX, which leads us to our second survey. Have you heard of DHS and MIX, or either one? If the poll could go up and we get the answer to that, well, I'll keep talking. So DHS is demographic and health surveys, supported by USAID. MIX is multiple indicator cluster surveys supported by UNICEF. There are large-scale household surveys covering a number of themes, including maternal, newborn, and child health. There's data from over 90 LMICs, and the data are available online on request and for free. So you get the idea, right? There's these large-scale supported surveys done with highly standardized data collection and analysis methods. The methods are standardized both across years and countries. So, there are changes and developments from year to year, but broadly similar across years with very large sample sizes. But some of the challenges is that they're not representative at the lower geographical levels, at the village or district level, where NGOs might be most interested, and collected every 3 to 10 years. So the data could be quite dated by the time your survey is, by the time your project is underway, and you want to know what the conditions are like today, not 10 years ago. So our hypothesis is that publicly available data can provide estimates of baseline conditions, similar to those reported in NGO baseline reports, when matched as closely as possible for location, year, and season of data collection. And I'm going to turn it over to Milena now, who's going to take us through the methods and the results.
Thank you, Peter. So our analysis were done in 3 parts. First, we extracted indicators from the NGO baseline reports, and we compared those indicators to estimates calculated from DHS or MIX, following as closely as possible the methods reported by the NGO. and matching to the closest year and region available. In total, we collected information for more than 100 indicators from 46 baseline reports covering 23 low and mid-income countries. The second part of our analysis consisted in comparing DHS versus DHS data from different years and geographical levels. And this analysis allowed us to work with a much larger sample size and to compare data from different years and geographical levels, but using the same source, DHS. And the third part, we performed simulations where the indicators were measured without systematic error, only sampling error. Next, please. So to compare the indicators, we calculated the difference and the absolute difference between estimates, and we calculated as DHS mix minus NGO, or the data simulating the DHS minus the estimates from the data simulating the NGO. And we created several graphs, some ANOVA models and some mixed models as well, in order to explore how the differences between estimates varied according to differences in year, geographical level, and season. And I'll give more details about each analysis as I present the results, because I think it'll be easier to understand. So this first graph here is a scatter plot, just to very quickly show what our data looked like. So on the x-axis, we have the estimates calculated from DHS and mix. And on the y-axis, we have the indicators extracted from the NGO surveys. So the closer the data points are to the diagonal line, the better, because it means that the indicators were very similar or the same. And we can see from these graphs that for all indicators, we can see some kind of correlation between both estimates. Next. So the second graph, sorry, it's a box plot, and we have here the difference between estimates by the indicator. And for those that are not very familiar with a box plot, here is an example for stunting. So we had 134 pairs of estimates, and the mean difference between them was minus 5%, represented here by the circle inside the box. And here we have the percentiles. So for stunting, 50% of the differences were between minus 10 and 0%, but we had some differences as high as 24% and as low as minus 42%. Next. So we can see from this graph here that only few indicators had all pairs of indicators within a 20% difference. Next, please. So this table here shows some of the results from the ANOVA models that we performed. And we used ANOVA to partition the variance of the absolute difference between estimates due to indicator, geographical level difference, and year difference. We can see from here that about 18% of the variance of the absolute difference between estimates was attributed to indicator, and less than 1% was explained by geographical level and year difference, and most of the variance, about 80%, was random or not explained by our model. This other box plot summarizes the results from the three parts of our analysis. So we have here the reference value, which is the DHS or the data simulating the DHS. And on the y-axis, we have the absolute difference between estimates. So there are a few things it's interesting from this graph. I'm gonna tell you about three things. The first one, if we look at the results in green from the NGO versus DHS mix comparison, see how the differences are the largest when the indicator is between 35 and 65%, and how the differences are smaller at the extremes. And this makes sense and is consistent with statistical theory that says that it's the hardest to estimate accurately when true prevalence is around 50%. Now, if we look at the results in red from the DHS versus DHS comparison, note how similar the differences from both results are. And this is interesting because it suggests that the large differences that we observed when we were comparing NGO and DHS data are probably not explained by methodological differences, since DHS that uses highly standardized methods performed similarly. And finally, the results from the simulation in blue indicates that sampling error contributes to only a small amount of the differences between estimates. Next, please. So from the DHS versus DHS dataset, because we were working with a much larger sample size, we were able to run some mixed models by subgroup of indicators. And with the results, we performed some linear regressions to obtain two simple coefficients that would summarize what's the impact of year and geographical level difference in the residual variance of the difference between estimates. I know it sounds complicated, but I'm gonna give you an example. So let's say for stunting, an NGO wants to estimate the prevalence of stunting in a certain province, but there is only DHS data from 1 year ago, and there is no data in the province level, but there is data one level up, let's say region level. So the stunting prevalence, let's say, was 40%. So the NGO would expect that the prevalence would be something between 30 and 50%. Next slide, please. And likewise, here, just very quickly, another example. Let's say the DHS data instead was from 5 years ago and geographical level difference. So the standard deviation would be something around 13%, which is not much higher than the previous example. And what does it all mean? Peter will tell you now.
Thanks, Milena. So we got all that, or some of it. The bottom line is that there is a large difference between NGO and DHS or mixed estimates. We find a higher agreement in the extremes. That's when the indicator is, say, below 15% or above 85%. But overall, only 30% of the pairs of indicators were within 5% of each other. So why would this be? We think of three possible explanations. One is that they're not measuring the same underlying true value. That is the NGO working in a certain village, and that village has a different underlying true village than the district or the province in which they're located, which we're comparing it to. Or it could be they're not measuring the indicators in the same way. Both NGOs and DHS will use standardized methods when standardized methods are available and established and agreed upon, but that's not always the case. There's always some wiggle room for how you measure something. It could be the case here. And then others where there is agreed upon ways to measure, there's high technical error of measurement. If you've ever tried to measure the length of a 1-year-old, they're screaming and legs are kicking, and you're trying to see how long the kid is within, a millimeter. It's hard to do, and so some sort of measurement error like that can happen with any indicator. So the answer should NGOs that we have to should NGOs forgo primary data collection for baseline, given what we said up to this point, you might be thinking I'm going to say, no, you got to collect your own baseline data. But there are some yeses when. So for some indicators, when it's expected to be in the extremes, less than 15 or greater than 85, or when the indicator of interest is one of the few with consistent similarity between DHS mix and NGO estimates. And most importantly, probably, is this third, where the NGO has tolerance for estimates of low or unknown accuracy and does not need estimates for all the 100 or more indicators that they report on. So it's not uncommon in a baseline report to have 100 or more indicators reported. The average match that we found between the NGO reports and the DHS or mix was about 18 indicators that we were able to get estimates from. And then there is a level of, if the NGO can tolerate lower unknown accuracy, they may be okay using the DHS or mix as well. So we've been comparing these point estimates, right? Point estimates that the NGO gets for their indicators and that DHS gets for their indicators, but they themselves are not measured without error, right? An NGO's estimate with a typical sample size, could be have a 95% confidence interval of plus or minus 5 or plus or minus 10%. So the NGO themselves, even if doing a baseline survey, are not getting a perfect picture of what they're trying to characterize, right? There is always measurement error in everything. So the choice isn't between doing a survey and getting a perfect understanding of your situation, or sacrificing that perfect understanding and using the DHS or mix estimates. Rather, it's a choice between getting a picture with some inaccuracies or accepting that you'll have less accuracy or unknown accuracy and using the DHS and mix. So for in the case studies that you're going to see shortly, implementation plans were not adjusted following baseline surveys. Remember, one of the common justification for doing a baseline survey is that you need it to figure out what you should be trying to do in your project. But NGOs usually already know more or less what needs to be done with their target populations. They're not going in there blindfolded and needing or going in there blind and needing the baseline survey to show them what the situation is like. They already know more or less what needs to be done. And furthermore, baseline household surveys don't have to be done for project impact monitoring purposes. There are other ways to monitor, to measure a project impact, which we could talk about later. So it's a very qualified answer that we're giving. An NGO could forego their baseline or parts of their baseline and focus on those indicators which are of more interest to them, if they can accept some of these qualifiers. So we thank Global Affairs Canada and CanWaCH for the wonderful support in this, and of course DHS and Mix and all the NGOs that shared their data with us listed here. And I think I see some of your names in attendance, and that's appreciated very much. We're going to now go to a couple of case studies. First from Minh in Vietnam. And Minh, thanks for joining us today. And I'll turn this over to you. And when you want the next slide, just let me know.
Yeah, thank you very much. Good morning and good evening. I'm happy to participate in this conference and have a chance to present you our case study findings. Next slide, please. To understand better the results of the main study, we conducted this case study to compare directly data from the mixed surveys with the data from an NGO baseline survey in Vietnam. Next slide, please. So for the method, we went through 4 key steps. Step 1, we identify a list of common indicators that are available in both data sources. And actually, we got about 38 indicators. Step 2, we review questionnaire of both surveys and the definitions of each indicators, or actually how to measure that indicators in each survey. And for step 3, we ran the data analysis, calculate the estimates for each data source. And finally, we extracted estimates from 2 data sources to Excel file for direct comparisons. So next slide, please. So for the findings, you look at, this is the logistic regression, linear regression we made between the estimates of the 2 data sources. So overall, we can see that the results of regression show a statistical significant correlation between the mixed data and the NGO baseline survey. And you can see that the R square is about 0.6 with p-values less than 0.0001. So it's the correlation for the 2 data sources we can see, but next slide, please. Looking at this specific table, you could see that some indicators that are in bold have absolute differences that less than 5%. And these indicators are more related to household characteristics, such as household with water and soap or hand wash, or indicators about nutrition like consumptions of iron, folic acid supplement, or vitamin A with rich food. So that the absolute differences that less than 5%. Next slide, please. For this slide, you look at, we can see that in this chart, we sorted the indicators from the smallest to the largest absolute difference, and it showed that the absolute difference that was about 10% happened in many indicators. As I mentioned, that we have about 38 indicators, and it's happened among it's about 55% that the difference is more than 10%. And there are some indicators where the absolute differences were more than 30%. And you can see that at very end on the right of the charts, the indicators related to breastfeeding, like initiations of breastfeeding within 1 hour after birth, and they continue breastfeeding at 1 year of age. Next slide, please. So again, discussion from our findings of the case study. We have 2 key points for the discussion. The large differences appear in certain types of indicators. It's not just only the, as Peter mentioned, that the very end of extreme data, like less than 15% or more than 85%, but it can appear in different types of indicators. And it may be a result of recent intervention or policy. For example, you can see that the big differences are related to breastfeeding in our countries. We could see that in recent years, the Ministry of Health actually initiated a policy where they forbid to sell or advertise formula milk in hospitals. So that could greatly contribute to the reduction of or the increase of breastfeeding early after birth. The second point is if the NGO did not conduct the baseline survey and use mixed data instead, they would have implemented the project differently with different focus in their intervention. And the measurement and measuring the project impact would be challenging, because you can see that if the difference is more than 10%, is not often easy for intervention to improve the indicators by 10 or more than 10%. So that could be difficult for NGOs to measure their impacts if they use a mixed data. So thank you very much for listening. It's the end of the case study in Vietnam. Thank you.
Thank you, Minh. And we have now a case study from Nepal, where Naomi is going to take over. And just let me know when you want me to advance a slide, Naomi. Thank you.
Okay, thanks very much, and good morning, everybody. So I'm, next slide, please, Peter. I'm presenting a case study where we are comparing, using the same hypothesis that Milena was talking about earlier, comparing an NGO data set from 2016, the International Nepal Foundation's baseline study, with the 2016 Nepal DHS data. Next slide, please. So the DHS data is a nationally representative data set, as Peter already described. And in Nepal in 2016, it covered 11,000 households, 4,000 mothers, and just over 14,000 children. And then when we come down to the province level, which is the orange shaded area on the map there, we see that we reduced down to about 1,600 households. And then reducing down again to the regional level, we have 500 households. And then where you see the green circle, that's the district where the NGO survey was conducted. And for the DHS, we only have 180 households there. So quite a small sample size. Next slide, please, Peter. So in our NGO data set, we had 543 mothers, so a much larger sample from the very specific region that we wanted to know about. And those data were collected at the same time that the DHS 2016 was going on in November 2016. Next slide, please. So looking at the data, the way that we have presented them is that the NGO estimate is there in red. And then we've shaded the DHS estimates paler the further geographically distant they become from the NGO estimates. So the district is the dark blue and the country is the palest gray. And you can see here that for these household indicators, some of them match reasonably well, like agricultural land is not so dissimilar, but then others are very poorly matched between the NGO estimates and the DHS. And I think this is because of the fact that the NGO is targeting the most marginalized and difficult to reach area of the plains that it's working in. So we see that the access to electricity, for example, is very different. The access to soap for hand washing. Bicycles vary a lot across the country depending on the terrain. They're much more prevalent in the plains, so it's better matched at the district level. Next slide, please. But if we look at the maternal indicators, we see that again, there's not a huge amount of difference between the different DHS levels, from district to country level. But, and we also see that the NGO estimates reasonably well matched to the DHS. So for our maternal indicators, I think we could get away with using DHS reasonably easily to set our targets. Next slide, please. But then looking at the child nutrition indicators, one of the challenges here is that the child population is broken down into smaller population subgroups because we're looking at 6 to 23-month-old children. And then we have relatively small samples. So we have big errors around these estimates. And we can see that the match between them is pretty low for all of these population subgroups, like the exclusive breastfeeding in 0 to 6 months and the vitamin A supplementation at 6 to 11 months. So for these kind of indicators, the DHS was really not making would not be a good proxy for the NGO data at all. Next slide, please. And when we did some correlations, I did non-parametric correlation because we only have a small number of cases. But we see here that the correlation between the maternal health indicators was high and was significant. There was correlation between the child health indicators, but it was not significant. And for the household indicators, it wasn't significant at all. Next slide, please. So what we found was that the correlation was highest between the regional level data and the NGO estimates rather than at a higher level or at the actual district level. But when we looked at the median absolute differences between the NGO and DHS, they were actually lowest for the country level and then for the province level. So basically the DHS population size makes a difference. It's better matched if you have a higher population size to compare with. And we found that the small sample sizes at the district level and also in the population subgroups for child age were really too small to enable us to make meaningful comparisons. And then when we looked at the NGO targets which had been set, as a result of the study, the NGO study, we found had we used the DHS data, it would have changed the targets quite substantially. And the other issue really was that the DHS data was being collected at the same time as these NGO data. So actually, in reality, we would have had to have relied upon the 2011 DHS. Next slide, please. So our conclusions were that the nationally available data could be drawn upon in Nepal, but prioritizing larger sample size subgroups for comparison. For maternal health estimates, they were closer to the DHS than the child or household indicators. But at the end of the day, we did feel that national level data really couldn't substitute for a well-designed, contextualized and mixed methods NGO baseline study where we're able to explore project beneficiaries' problems, ways of overcoming those problems and barriers to the problems. Next slide, please. Thank you very much to all our partners, and thanks for the opportunity to share our results. Thank you.
Thanks very much, Naomi. So I'm going to have a few points of discussion and then open it up for comments and questions. Some ideas that or two ideas we have for next steps is, so the comparisons that we did were of NGO to DHS level data, and the DHS level data are not sufficient sample size, are not representative at the village or district level where NGOs are often working. But there are cases, where you could have plans working in this village and 100 kilometers away, World Vision's working in that village, and they're on similar topics and collecting data at the similar time. And would that sort of, would comparison of the data at that level be more helpful, be more similar? And the sort of building on that, we were thinking it would be good to just do this intensive case study in a single country where, yes, we have DHS and mix and NGO, but there's also government data, there's multiple NGOs, there's academic research being carried out. And if you have all these different data sources, does it present a cohesive picture so that it would then enable an NGO to, I don't know how, but somehow use this this big ball of data instead of having to do their own baseline. So that's where we're at, and I think we can open it up for comments and questions. I have a couple of topics that we could talk about, but maybe you all have something that you would like to say first. So how does this work? Does somebody put up their hand?
Yeah, well, what we can do is we can do a few different things here, but we do have a couple of questions that folks have written in the chat, so we can touch on those first and see where they take us. But again, inviting folks to either write your question in the chat, or you can come off mute. You can use the handy raise hand function, and we'll try to catch you. But I think it's best to just come off mute. We're all friends here. There was one question here that said, and this came earlier on. Did you look at what impact it would have on the observed impact of the project if the NGO had used a DHS-informed estimate of baseline instead of a project-specific baseline?
Yeah.
Yeah. We thought of it. We haven't addressed it yet, though. It is something we'd like to do.
Great. And Kendra, who has the question, please feel free to come off mute if you'd like to add a little bit more. We also had a few comments here just saying this is a tremendous work so needed to guide our efforts on evidence-based decisions around project investments, as well as evaluations that really tell the right picture. Great point, Janet. And then we also have a question that just came in. They're really interested to hear more about your assertion earlier that baselines are not used to influence changes in project design / implementation. Anything more you'd like to talk about that?
That's actually one of the questions that we had for the audience.
Wonderful, wonderful. There you go, prescient.
Yeah. So it's certainly not from any sort of survey of what people normally do. It was based on some experience, and So there's maybe a distinction worth making is, I think what Naomi said is that the targets would be different if you use DHS instead of your own baseline survey. But the things that are public health problems that require a public health level intervention are usually known, right? It's not like the NGO surprised to find out at the level of exclusive breastfeeding or the level of facility-based births. It's they may not have known that it was 70% and not 50%, or whatever the numbers are, but it still requires a public health level intervention, which the NGO usually would have known. So that's my experience, but not based on data. And so I'm curious of others' experience and what you think of this question.
Yeah, I see that Salim has just raised his hand. Salim, do you want to come off mute? Do you have something to share on this or a question to ask?
Sure. Thank you. First of all, thanks, Peter and the team for excellent study and findings, and thanks CanWaCH for organizing this. So one of my comment is that, Peter, as you were mentioning, or one of the study that was shared, that if the estimate is lower or higher or on the extreme, it's fairly accurate, makes sense, because, for example, if I'm estimating immunization coverage, I don't care if it is 20 or 18 or 25%, it is low. And if my end line shows that I am 75%, I again don't care if it was 70 or 80%, but I had made some change. However, if this is somewhere in between, where it's difficult for me to exactly estimate that I didn't achieve my objective, but I did make some change. So one of the suggestion here is that can we triangulate the information that we get from MIX or DHS with our ongoing monitoring, because all projects do continuous monitoring, and then we could triangulate that information, and that may be one way of dealing with it. The other comment that I wanted to make in relation to the cost, prohibitive cost and energy that we put in baseline and end line is huge. So, and that is because sometimes we get carried away, and many projects starts collecting tons of information that is not even used. But if we are focused, and if we still do a focused survey, but small scale, and estimate only those indicators or proxy indicators or few indicators that we will going to use in terms of guiding the progress and in improving quality, could be yet another way of handling this issue.
Thanks, Salim. Triangulation is something that we thought about, and we briefly thought if there's a formal way that we could do. It's Bayesian analysis, right? Where you don't start without any information of what the situation is. You have your an idea of what the situation is like, what the baseline characteristics are like, and then you would carry out a survey and you would modify that that prior is in Bayesian. And then we gave up because to actually make it a formal Bayesian method would be too hard for us. It'd be, as we said, a PhD and a half to figure it out. But there are other ways to triangulate. But it'd be an interesting, not in this project, but in the Nepal data set that Naomi presented on, we tried quadrangulation, comparing the survey data, the project monitoring data, local health system data, and then also interviews with the local staff of what their on the ground assessment of what happened. And man, it's hard because things don't agree, right? If the survey points in one direction and process data points in another, and the staff think that everything went wonderfully, it's hard. So triangulation is it's great if it all works out. Very frustrating when you don't end up with a nice triangle because everything's pointing in a different direction. And decreased number of indicators. Yes. absolutely. We've all, well, shouldn't speak for all of us. There have been many surveys where so many indicators, so many questions are asked, because there's this, the understandable feeling that, well, we're there anyways, we may as well do these, collect this data as well. But my feeling with absolutely no data to support it other than what I see is you can get about 20 minutes of goodwill, conscientious answering, and then respondents lose interest. So you can collect more data, but does the data quality suffer if it's, the 150th question that you've answered, that you've asked over a 2-hour period? So yeah, I agree with that one, absolutely. And if anyone actually had any data on how data quality varies with length of survey, that'd be fascinating. Thanks.
Yeah. Thanks, everyone. And I want to pick up on 2 questions that we've got a few in the chat, but there's 2 that I'm going to group together here about kind of the prospective use of this. So one observation, it seems that an NGO wouldn't know which indicators from DHS are similar enough to use unless they've already done a baseline. So is the idea not to have to do additional baseline work if they also work in nearby regions or otherwise? And then later on, we had a comment, thanks for a great presentation. The conclusion I'm taking from this is that you can't know whether the DHS or mix can substitute for NGO studies, even for specific indicators, unless you conduct the NGO study anyway. You can only know in retrospect. It's interesting to see the indicator comparisons, for example, in Nepal, but I'm not quite sure how future programs could use such info prospectively. Any thoughts or responses, reactions to that?
Right. So the only way that we had to answer this question was to do this retrospectively and then consider if you hadn't done the baseline survey, how different would it be, right? So, and that's what the differences that we get are, some of 20, 30, 40% difference in the estimates. And of course, no, you wouldn't know how different you are between the DHS and your own survey if you haven't done the survey. The point that I tried to make at the end was, even if you do your own survey, you don't know that you've got the right answer, right? You still, with your own estimate, and you're going to have an error, just the normal sampling error of plus or minus 5 or 10 or 15%. So if you did use a different data set, yes, it would be of unknown similarity to the underlying conditions that you're trying to represent. But even when you do your own data, you still don't really know. So it's not a comparison of use DHS and get a wrong answer, or use your own and get the right answer. It's use your own, get an approximation, or use somebody else's and get an approximation of an unknown accuracy.
And can I add something as well?
Please.
Like, for instance, if you're doing any a study, an NGO more or less knows, like, if an indicator in that region that she's going to work, it's going to work, if it's too low or too high. So you might have an idea, okay, for this indicator, we might be able to use public available data, or for other indicators that are more around 50% might not be useful.
Naomi, I saw you raise your hand, and I'll just, while you're coming off mute, acknowledge, thank you. Michael has shared in the chat a copy of a study about the relationship between DHS survey length and quality of survey responses. So thanks for jumping in on that one, Michael. But Naomi, over to you.
Thank you. I think one of the take-homes that I take from this piece of work also is the importance of remembering the limitations of using baseline endline evaluation in the first place, because what I see happening here in Nepal is that when I go to presentations about people's work, they show the baseline and then they show the endline and they say our project did this. But I do a lot of cluster randomized controlled trials where I have a control arm where we don't do anything and we compare our indicators from baseline to endline, or we compare indicators over time, and we see secular changes and improvements over time anyway. So, you know, this whole kind of use of the baseline survey and then setting a target and saying we are going to achieve this outcome at the end using a baseline endline kind of ecological approach is actually quite flawed in the first place. So maybe we would be better off actually rethinking how we design our evaluations and doing an endline evaluation with a comparison group where we didn't work. I don't know, I'm just putting that idea out there. Thank you.
Great and challenging point, Naomi. We had a couple of questions here about applicability elsewhere. So one question here that I'll start with was, what are the considerations for aspects of an intervention that aim to change behaviors or perceptions? And then we also earlier had a question about curious to know if this learning is transferable to other sectors. Would we need to conduct the same level of research and testing on available data to be able to draw conclusions? So a question broadly about the applicability of this to other sectors, and then quite specifically, what are the considerations for an intervention that is focused on behavior change or perception change?
What we should do, and I don't think we have, Milena, is if we look at the indicators by sort of that category of you know, indicators that measure knowledge or behavior, and then another group of indicators that measure physical outcomes like stunting, and others that are on health systems accessing. I don't know if we've done that, and if we have, I don't. It would be worth doing. I don't recall there any particular pattern that behavioral type of indicators perform any better or worse than others.
Yeah, we didn't have many indicators related to behaviors or knowledge, because DHS doesn't provide much of those indicators, so we weren't able to compare.
And sorry, the second, in other fields, we were thinking in you know, what other fields have so much data, and agriculture certainly does. So it'd be wondering how it would work there if you used countries' production estimates, and if that could replace farm level estimates. I don't know, and it would certainly, I wouldn't want to apply these findings to any other field without further study.
Understandable. I'm just going to call on Jakob or Juliana, who asked those questions, if they want to come off mute. Was there anything else that you wanted to build on with that?
Yes, thank you. Thank you, Jessica, and thank you to all the presenters. This is really wonderful, and I think we can all agree that we can spare us some work and save some money to different projects.
Great, thank you. Thank you, Juliana.
Sorry, I didn't hear the rest of her question.
Oh,
no, I hadn't finished. No.
Oh, okay. So sorry.
I'll be brief. So the question we had was about the components that are concerned more, as I try to express, behavior or perception. But I think I got a bit of an answer, and I just wanted reassurance, because I saw how the indicators that are linked to household questions seem to be not so well aligned compared to those that are maternal indicators. So I think we can be very comfortable using maternal indicators from national or like the standard data sets, like either DHS or MIX. But when it comes to household decision-making, you know, who helps you go to the doctor, or that kind of data is what I don't know how we could then forego a baseline or an endline to see how much we change that. But I think, again, thank you for your presentation. And I think it's just those questions that pertain more of the household or the economy in the household, decision-making in the household, that would be a bit more in the gray area. Thank you all. Thanks, Jessica. Over.
Thank you, Julia.
Yeah, I mean, if there are no data on your, and it's something that you need to know, then there are no alternatives to doing some sort of primary data collection. But I did want to make one comment on, you said you could be comfortable with the maternal health indicator estimates. And I would say, I mean, you can use them, but don't be comfortable. Be uncomfortable because there's uncertainty in this. So of course, if you do a baseline survey, still be uncomfortable because there's uncertainty there. So but we live in an uncertain world, and be uncomfortable with that, or be comfortable with your uncomfortableness. Thanks.
Thank you.
What a great point. So we've got 5 minutes left in this conversation. Peter and colleagues, was there anything, any final points, final questions that you wanted to leave the audience with, or things that you'd like folks to be thinking about, because this will certainly not be the last conversation on this topic that we have?
We did have this question as well, but I think we've been over that a little bit. Aaron, it's something to think about, and I don't expect anyone to really have an answer right now. But if there's comments, it'd be great. And I think, during the rest of this discussion, we can put up our contact information there. So if anybody would like to follow up with us, and we do have a summary report, about 10 pages long, that pretty much is ready to go. We may want to tweak it a little, and then the full report should be ready soon. And then we'll also be putting this into academic transcripts, and or academic papers, and if you're interested in any of these reports. I think, Jessica, you have the summary, I think.
That's right, we do.
It's shared
actually
already.
Yeah, we shared it earlier, and you shared it earlier in the chat. I think it's really incredibly helpful. Oh, and she's just bumped it up again. So thank you, Antu. We'll also make sure to share it with the recording that goes out to folks. And then as well, as we mentioned, or as you alluded to, Peter, in the next couple of weeks and months, so all of the labs are coming to a conclusion in a month or so. And whether these or other pieces of work that folks are working on will be combining these and doing more conversations like this one to really dive into some of these technical aspects. So there'll be lots of great resources being shared with folks. And this is just a taste of it, but we'll make sure that you've got it on hand. And our hope is that we'll be able to build on these conversations, get your reflections, and a lot more. So perhaps just again, since we're at this time, I encourage all of you to make a note of these email addresses, but also feel free to reach out to us at CanWaCH anytime. And we're happy to put you in touch, and we'll be sharing these resources with you. And I just want to take advantage of this opportunity of final remarks to reiterate what I said at the beginning, which is when we conceived of the concept of the collaborative, the idea here really was to create space to look at questions that have the potential to really affect how we work and think them through as a sector, bringing together the incredible expertise and insight of Canadian academic partners, Canadian civil society and NGOs, global colleagues and partners and their expertise, and create space outside of an individual project's M&E budget to really have the creativity and space to do it. All of our labs do that work, and I think this one has always jumped out at me as one that's really tackling this question that can have implications, as we saw, for so many different areas of work, and not just necessarily one particular sector, although your point, Peter, is well noted. So thank you to everybody from this lab. Thank you to all of you for attending and sharing your questions. Keep them coming. We'll flip them to everybody here, and we look forward to talking even more once the work of the lab is over about what this means for all of our collective work. Thank you for asking your questions, and thanks again for taking the time today. Much appreciated.